Good morning, everybody. First, I'd like to thank ComPro for inviting us to participate this morning. And thank you to Kayla and her team for bringing Physicians Mutual into ComPro to give you guys access to our portfolio. I probably will not take the whole hour, but I will be open to questions at the end. So if you can type them into Kayla, she'll get them to me and we'll get them answered. So we'll get started here. So really our product portfolio mainly is dental insurance, life insurance, which is guaranteed issue. We do a little bit of term insurance and then Medicare supplement planning. And then our cancer insurance is Medicaid spend down friendly, as long as you do not put on the lump sum riders. So today we're going to talk a little bit about why Physicians Mutual is different. Number one, we got a couple of Medicare supplement plans that are patented. We have an exclusive unlimited preventive care benefit, preventive benefits plus Silver and Fit membership. That's a gym membership, and we do cover 100% of that cost, depending on where you're at and which network you choose. Exclusive 2-year selection guarantee. We get a right turning 65 meds up 7 months in advance. And that goes all the way back to when we were career agents. We always wanted our agents to be in the house before other carriers could be in the house. And we've been able to keep that, and that allows us to be a little bit more user friendly. The other thing that's not on there, we could have started writing Medicare supplements for replacing Medicare Advantage plans. So you could actually do a med sup today on an Advantage plan that wants to be replaced or needs to be replaced with a January 1st effective date. We do use age bands with our pricing, very similar to other companies. Limited underwriting on ages 65 through 68. Our customer satisfaction rating is 95%. We'll talk about that. And then the household discount is a little bit different than other companies, and we'll visit about that today as well. So first of all, we'll talk about our innovative Plan G, which is a patented Plan G. But to understand it, the high deductible Plan G works very similar. So if your client would go to the hospital and they are overnight admitted, they would pay the $1,600 Part A deductible. At that point, I'm assuming they're going to have a Part B deductible because they've visited with some doctors and received some type of care from a doctor. And then the Medicare is going to pay 80% of all the rest of the Part B claims, and the client would pay the 20%. So when you add the 1,600, the 226, and the 20%, when that hits the max out of pocket of 2,700, you have 100% coverage for the rest of the year. So when you look at that, and there's some pricing out there, but Medicare Advantage plans have a place. I'm not going to knock them. I sell them. But there's a lot of people that can't afford a full-blown innovative or a regular Plan G. But when you look at a high deductible premium and the max out of pocket is $2,700, that's lower than current Medicare Advantage plan max out of pocket. So, and there's no network restriction on that high deductible Plan G. They can go to any doctor, anytime, any place, anywhere. So we'll go to the innovative. The Part A deductible works the same way. The Part B deductible works the same way. 80% Medicare coverage, then 20% you. Max out of pockets, $2,700. So you would have that deductible. If you purchased it for an October 1st effective date, you would have it for October, November, December, and then 2 more years. So on January 1st of 2026, that deductible would go away, and you would have a regular Plan G with a discounted premium. The Part B deductible is going to reset every year going forward, depending on what Medicare chooses. That will change, as well as the Part A deductible and the max out of pocket. So basically, at the end of the 3rd year on January 1st of 2026, the Part A deductible is going to go away. the 20% is going to go away. The $2,700 is going to go away. And then you're going to have a Plan G at a discounted premium. And then you'd have 100% coverage at the rest of the year after you've paid your Part B premium, currently $226 for 2023. The deductible elimination time frame, this is just a chart that if you had a January 1st effective date, it's 3 full years for that deductible to go away. But when you look at, as you move around the calendar, the later you purchase it, the shorter your deductible is. So, and this is not a new product to Physicians Mutual. It's been out since 2008. If you want a plan that's not going to leave you and get changed to another company because of low cost, not going to happen. The lower premium cost for life, there's a 25 to 28% discount based on the zip code that you're currently in. My dad bought this plan. He's just turned 80 in August. He bought it when he was 70, lives in 686 zip code. He was paying $98.41 that year, and that included a household discount. His rate increase that he got this year put his premium at $151.12. You cannot buy a Plan F from any company for that premium. So the rate increase history is very low. Based on data from 2008, the average out-of-pocket cost per person with the innovative discount rider during their first 3 years is $518 per year, or $1,553 for your first 3 years. You have to remember, part of that $518 is your Part B deductible. So if that deductible was $226 this year, I believe it was $244 last year, that deductible's jumped around, but half of that $518 per year has been the Part B deductible. And then the percentage of customers who did meet the plan's deductible during year 1 was 4.3%. Any year of 2 or 3 is 10.7%. And any of the 3 years, 20% had met their deductible. So this chart here is something that's kind of interesting. I used a rate for a zip code in 681, which is Omaha. It's a female rate. It does include the household discount, and it does include the non-tobacco discount. And we used a 7% annual rate increase. So as you look at this, if it was a 65-year-old, they would pay $88.04 for an Innovative G, and the Plan G would be $122.31. That red or the blue line in there is $107, and then $149 for the G. That's when the deductible is going to go away if you purchase that plan at age 65. So if you look at the total savings for a female client from age 65 to age 80, total savings on premium would be $11,468. If they hit their deductible one time at $2,700, they're still ahead of the game by about $8,700. So you can see the difference on the annual rate increase history of how much money a client can save. And when they're 68, they're going to have the same Plan G that everybody else has, with the exception of the preventive care and the silver and fit that other carriers don't have, but they're saving a lot of money on their premium. Our unlimited preventive care benefit, I don't know of anybody else that has it in the industry yet. A full physical, you can get one done. The average cost that's been submitted to Physicians Mutual has been between $300 and $900, and we will cover that regardless of any unlimited preventive care we cover. We don't care what Medicare schedule of benefits say. We're covering it. Worst case scenario, you go in for something and they find some health issue and they turn it over to a diagnostic claim. It's going to go to your Part B deductible. And then if you have the innovative plan, it would go towards that 2,700. If you had a regular plan G, Medicare is going to pay their 80%. Physicians Mutual would pay their 20%. We do 100% coverage on Lifeline screenings. And those are done generally in YMCAs, churches. You go there, pay the claim, submit the bill to Physician Mutual, because Medicare does not accept Lifeline, the company, their billing. You'll have to submit that to your agent or ComPro, and they'll get it submitted to us, and we'll get your reimbursement to your client. Thermography is a new cancer screening. And I have encouraged every client that I sign up to go get one done. There's many body imaging places that do this. Physician Mutual is the only company that does pay for it. No other company does. It's a full body scan, and it can find cancer or other issues of health before it becomes an issue. It's scanning blood flow in your body. We had an agent in our office that just didn't feel good for about 2 or 3 years. Always went and got her mammogram yearly, and it was always negative. She went in and had thermography done, showed stage 4 cancer, and she passed away about 9 months. Her sister went in about a year later because she had negative breast cancer screenings, just kind of was feeling rough. Went in and they caught it before it was stage 1. They got it whipped out. And it's all about preventive care. And that's really, Physician Mutual will cover 100% preventive care. And then a full panel CBC blood panel. Medicare don't do that every year, but Physician Mutual will. So that's our unlimited preventive care. There's a lot of other procedures that's covered, just too many to list. Lifeline screenings, here's some of the screenings that they do. Testosterone deficiency screening, congestive heart failure, AFib, COPD, diabetes, liver enzymes, kidney disease, thyroid disease screening. And I even tell our male clients to go get this done, because prostate cancer and a lot of other things, it detects it before it becomes an issue. And this is just a little bit about thermography. And then one of the things that I think is interesting, cardiovascular disease tops the list at over 50% of deaths annually. So it's pretty cool deal. And it'll help you in the preventive care side. Our Silver and Fit is new. There's over 14.8 thousand participating fitness locations, fitness centers, exercise studios, outdoor group exercise sessions, community centers, and a lot more. This is available in Nebraska, Arizona, Oklahoma currently, and then there will be 3 more states getting added this month. But there's just some of the standard networks that are on the screen. Silver and Fit, you get an at-home kit 1 time per year, whether it's a wearable activity tracker or Fitbit. I mean, there's just a lot of extra stuff that you get for having a Silver and Fit membership. Preventive Benefits Plus is what they're calling it now. Preventive Care and Silver and Fit. That is available in Nebraska, Arizona, Oklahoma, Alabama, and then the 22nd, it is going to be live in Tennessee, North Carolina. And then Silver and Fit is coming in 2023 to Iowa, Texas, South Carolina, Louisiana, Wisconsin, Illinois. And hopefully that they will all be done before the end of the 3rd quarter and start of the 4th quarter. The Department of Insurances have been questioning a few things, so we're working through those. Preventive care is still included in all of them, just not the gym membership yet. And then mid 2024, first to second quarters, Nevada, Utah, Colorado, South Dakota, Mississippi, Indiana, and Ohio. Standard plans only. We did start these 4 states here effective September 1st. Missouri, Kentucky, Florida, and Georgia. They do not have any preventive care. They do not have Silver and Fit. And the plans available are A, F, G, and N. And they do get the 2-year selection guarantee, and we'll talk about that. So basically what happens, it says, in any of the first 2 years of owning a policy with Physicians Mutual, you can switch to any of our plans up or down in coverage without any underwriting. So if you had a high deductible G and you went to the doctor and you had a health issue, you could send in a letter and get that high deductible G changed to a regular plan G the first of the month following that letter. So you turn it in today, you could have it for October 1st effective date. And that would be available only to first-time buyers of Physicians Mutual. So if they had a plan with us 10 years ago and they got through underwriting and bought our new one, they would not be eligible to switch. Our age banding, anybody that buys a policy between the age of 65 and 68 has the same price as a 65-year-old. And then at age 69, they would get their first increase for their age. Every one of those policy owners would still get an increase for medical inflation. So it'd be a lower increase because no age was assessed to it. Our limited underwriting, here's our health questions. They're very simple. I'm not going to go through them all, but I will tell you, if you have somebody taking insulin outside of their open enrollment, Physicians Mutual is not the company to write them with. We will decline that. But if they took 2 or 3 pill forms for diabetic medication with 1 blood pressure medication, or vice versa, 1 diabetic medication with 3 blood pressure medications, we would take that application. So pill-based, anything that's 4 or less with blood pressure and diabetic medication, we would look at that application. 95% customer satisfaction guarantee, or rating, excuse me, it's not a guarantee. But if you can do something and get that kind of a rating at 95% in any business, let alone the insurance industry, you must be doing things right. Part of it is our customer service is at 2600 Dodge Street. So it's local, easy to get a hold of people, easy to understand people. And that's been done by the Weiss Ratings Company. And that's how we got that rating. They sent out many emails and phone calls, and that's how it came back. Physicians Mutual has been in business since 1902. Household discounts. So it's a 10% discount off of your tobacco or our tobacco rate. You don't have to figure that out. It's already pre-calculated. It equates to about 11.25% discount. If you're married, your spouse can be any age. 35, 45, we don't care as long as they're married, they get that discount. If you're not married, but your roommate is 60 and above, you'll get the household discount. The other thing is you do not have to have 2 policies in the house. If you're the only person with the policy, you still qualify for the discount, which is a little bit different than other companies. Our dental plan, there is no deductible. There's no annual or lifetime maximum cash benefit per year or life of the contract. We do pay 100% preventive care. Preventive and basic care begin immediately day 1. We do have a 12-month wait period for major benefits. And then we do pay a $1,000 benefit for implants. And we opted to do that benefit for implants instead of waiving the deductible if you had dental insurance coverage before. So the implant part of it is where the $1,000 max comes in, but there's a whole lot of other procedures that need to be done to complete an implant. And if you buy the Premier plan, that would be covered at 70% for all those other procedures up to that, leading up to that implant. The only benefit for that $1,000 is the actual implant itself. And then we're not much different than any other carrier. We use the American Dental Association schedule of benefits, and there's over 400 procedures on that currently, and we cover all of them. So this is a little bit of our brochure, Premier, Preferred, Standard, Economy, and we'll talk about that. But first, I'm gonna maybe run this video. We've had some difficulty with it, and I'll see if I can get it to run.
Why buy dental insurance from Physicians Mutual Insurance Company? Because this is real dental insurance that helps cover over 400 covered procedures, the ones you're most likely to need. There are no deductibles, and you can go to any dentist you like, or you can save more by seeing a dentist in our network. Right away, we provide coverage for both preventive and basic care, such as cleanings, exams, and x-rays, or fillings and simple tooth extractions. After 12 months, we help pay for major procedures, things like root canals, crowns, bridges, even dentures. All 4 coverage options have the same features, such as 100% coverage for preventive care when you see an in-network dentist. No waiting periods for preventive and basic care, and major care begins after 12 months. No deductible, no annual maximum on cash benefits. The only difference is how much each one pays for basic and major services. Our Premier Insurance Plan pays 70% of your covered basic and major procedures, and our other 3 insurance plans pay a set dollar amount. While the Premier Insurance Plan costs a little more, it pays the highest benefits. No matter which option you choose, there is no annual maximum on the cash benefits you can receive. Plus, we offer optional vision and hearing benefits. So don't wait. Get dental insurance from Physicians Mutual Insurance Company before your next checkup. Physicians Mutual, Physicians Mutual.
So that video is on our link on S3, and we have a lot of agents that just run that video on their website, or they run that video when they're selling dental. The video itself really does sell the dental. Our home office is selling about 270 dental plans a day on the telesale side. So if you're not asking for that dental sale, you're missing out on a little bit of commission. And I may or may have not talked about this. It is the Emeritus Network that we are associated with. So very large network, very good network. The dentists are very receptive to it. So on this screen here, the preventive care, regardless of the plan that you have, from Premier all the way down to Economy, as long as it's at a network dentist, all of the cleanings, exams, and x-rays 2 times per year are paid at 100%. So the basic treatment on the Premier plan, and this is all network, in-network benefit, is covered at 70%. When they talked about Preferred, Standard, and Economy being a set dollar amount, that is an indemnity plan. And when they calculate their claims, it's paying about 55%, 40%, and 25%. But I know on a crown for sure that 55%, they're taking it off because the crown itself pays for $401 of it. There's a lot of crowns that are $900, $1,000, but there's a few other procedures to the crown that would be added into that. And that's how they're coming up with that 55% or 40% or 25%. Our eye exam, it does not matter where you go to get this done. It's a rider that's added to our dental plan. It is not a standalone policy, has to have the dental with it. But we will pay $100 for an eye exam, and that in a year. And then after a 3-month wait, we would do prescription eyeglasses, sunglasses, sport glasses, spare pairs, contact lenses, and they're gonna send you $150. For the eye exam and the hearing, or the vision and the hearing writer, it's $8.95. So if they just go get an eye exam, they've got their $100 back. And then hearing exams, you get up to $75 per person. And then you get up to $500 per hearing aid per ear after a 12-month waiting period. If you do use the vision, if you use a VSP provider, you do get additional discounts on your exam, glasses, contact lenses, and some surgeries. LASIKs and that type of stuff. This is where all of the plans are available for dental and med subs currently. So one quick thing before we go to quick questions and answers. I will do a contest here for ComPro and their agents. How that contest will work, we'll start it October 1st. We will end it on December 15th when ACA open enrollment ends. And that would be $25 per issued dental app. It's unlimited. You have to write 10 to qualify, and it goes back to app number 1. So if you did do 10, it's $250, but it's not capped out. So if you write 20, it'd be $500. And I will reach out to you, find out what kind of gift card you want, and that's how we will go through that. It don't have to be a Visa. It can be anything you want, but we'll make it work per agent. So I'll open it up to questions, and we'll kind of go from there.
We have a couple questions in the chat. I'll go ahead and read those to you, Doug.
Okay.
If a person gets the Preventive Care Plus rider, would it pay out even if the deductible is not met?
Correct. So our preventive care benefit starts $1, whether you've been to the doctor or anything. It does not count. It will pay before the Part B deductible or the hospital deductible.
Great.
First dollar benefit.
Next question. If we have a Physicians Mutual Med Sup and a person wants to add a dental policy, will the 12-month waiting period be waived on the dental plan?
No, we're still going to have the 12-month wait. They do get a discount of 5% off the dental if they have Physicians Mutual Medicare Supplement already, or if they purchase a new one. And the reason we didn't waive the deductible is we put the implant benefit on there for the $1,000, but there's a lot of other procedures that if you have the Premier, it's going to be covered at 70%. If you have the Preferred, it's going to be covered at about 55. So we chose to give more dollar benefit than waive the deductible.
And the waiting period only applies to major services, right?
Correct. Everything else is day one, except for crowns, bridges, root canals, implants, or other major care, plates, that type of stuff.
Can you go over pricing on the Premier dental plan?
Yeah, so single person is $56.95. If they have an a med sup with us, it's $53.67. And I should have brought a pricing sheet, and I did not.
If you want to send it to me, I can get it out to everybody later. Follow up.
Yeah, I will actually, when we hang up or when we come off, I have it on my computer so I can forward it to you right away.
Perfect. That'd be great. One more question we have, is the commission different on any of the, does commission vary based on the med sup plan?
No.
Okay.
It's all the same. And I would tell the agents that are on here to talk to Kayla or her commission team and discuss commissions with them. That is something that I have nothing to do with.
And what's the commission on the dental plan? Okay, does anyone have a question that they would like to ask? If so, please go ahead and unmute yourself and you can go ahead and ask Doug.
Kayla, that dental commission, we will visit when we're done because we'll have a little bit of time before the next.
Sure.
Other questions? Briefly, I'll talk, all you folks have been set up on www.physiciansmutual.com. The easiest way to get to us, you click on the agent and broker portal. And then if you need help with that, reach out to myself. And I'll leave my phone number. You guys can write it down, 402-720-3327, or call my assistant, Danny. And her number is 402-391-9061. But we do have paper apps, remote app, integrated voice recording signature, DocuSign signature. And then coming soon, we're gonna have 3 different pay options now instead of just the ABW. So we'll be able to do some pay options right on that electronic application as well. Whether it's quarterly, annually, credit card, that kind of stuff will be available as well.
Doug, I just thought of a question. If you submit an application 7 months in advance or 6 months in advance and the client doesn't have a Medicare ID number, how does that coordinate and what follow-up activity needs to happen to make sure the policy gets issued?
So one of 2 things can happen. When you do the application, whether it's paper or electronic, there's a box that says where it asks for the Medicare HICN number. You can click the box that says unavailable. So one of 2 things will happen following the issue of that policy. There will either be a claim come in and physicians will pick that up from the claim submitted by Medicare on that. Or if they don't have any claims within the first 6 months of that policy, the agent will get email asking for Jane Doe's Medicare number. But
Thank you.
I would tell you generally, there's claims being processed most of the time before that 6-month window. So physicians is getting that off of the claim submitted by Medicare.
Doug, do you want to talk briefly about your rate stability on the MedSup plans?
Yeah, so I can safely say, and you can check this out with the Department of Insurance, we're one of very, very few carriers that's never done a double-digit rate increase with their old products and their new products. Our average rate increase since 1992 has been between 6 and 7.5%. So, and the other thing, the rate increase when we're going from 65 to 68, when they're turning 69 and now they get their first rate increase based on their age and medical inflation, they're going to get the same rate increase that everybody in Physicians Mutual's blocks of business received as well. They're not singling out this newer block of business that had a age band. They're all getting that same rate increase. And it's just, we're very fortunate. And I know there's policy owners that have old policies, and those rates maybe are higher, but they've been in force for a long time. But I've been with them since 2008, and the rate increase history has been phenomenal on the low side. We are not the least expensive Medicare supplement plan in the marketplace, but we add a lot of preventive care benefits, and I think that keeps our claims history and ratio lower. because people are using that preventive care benefit and catching things before it becomes a high dollar health insurance claim.